Welcome to this session as we are still looking at neonatal nursing. Today now we are going to be looking at normal newborn as being presented by Miss Amito Prudence. So we already looked at how the newborn can, or how the neonate, or how the process of fertilization and all those things. We already assumed this mother was pregnant and has already delivered. So we want to know what really, who is a newborn, or what happens after birth. So first and foremost, we need to know who is a newborn. So a newborn refers to a baby within 28 days after birth. So any child or any baby which is just 28 days old is still called a newborn or a neonate. So in most cases, you find we are calling it a neonatal period. So a neonatal period is that period within 28 days following birth. So immediate and ongoing care is essential for adaptation of extrauterine life in most cases. So we have a few areas of focus following birth. One, admission care. We have health assessment, hygiene, nutrition, safety, and bonding of the newborn. So admission and the first 4 hours. One, we assess for risk factors. This assessment we are doing is not on the mother, it's on the baby or on the newborn. So we have maternal infections like hepatitis B, HIV. We have gestational diabetes. So we can check from the maternal book to find out if this mother was having any medical condition, because we know such condition can be passed down to the newborn while still in the uterus, or to the fetus while in the uterus. Now that they are born, we need to find out their state or their health, if they are at any risk. So we need to know about also substance use, prolonged rupture of membranes, vacuum, and instrumental deliveries. If you have done any kind of instrumental deliveries, you need to check or assess the fetus to find out that there are no harm or injuries. Use of narcotics. If there was a meconium stain, you reassess the fetus or you assess the newborn to make sure they are in good condition. Then we shall do head-to-toe examination or assessment. So the head-to-toe examination should be done by a nurse within the first 1 hour following birth. Within the first 1 hour. That is what we call a golden hour. Okay? First 1 hour. We have physicians can examine 24 hours after. And again, before discharge, you are supposed to examine. Maybe you missed out something, you should reassess. Match the baby's IDs with the mother's. It is very important. We don't practice these things in Africa here, but that is what makes children get lost from the hospital. So if the baby is having any kind of ID or a band, you match it with that of the mother. As for you, you are going to assess the baby. So we have neonatal admission records. Everything which you have assessed on the baby should be recorded. Birth condition and transition, labor, birth notes, antepartum history, maternal infection, any substance, age, pregnancy issues. All those things about the mother should be recorded in the neonatal admission records. So we have some routines or assessment that you're supposed to do within 24 hours. One, we have weight in kilograms, in libs, in horns. So the normal weight of a newborn at birth is 2.5 to 4.5 kilograms, an average of 3.5 kilograms. So any child which is less than 2.5 kilograms is abnormally is having abnormal weight or abnormally low. Then we have any child which is more than 4.5 kilos is abnormally big. or what we call a macrosomic baby. So that will help you to dig backwards to find out the maternal condition during pregnancy, and you help the mother also. Then we have the length of the fetus. The length of the fetus is taken from the head up to the heels of the newborn. So usually the normal one is 48.2 to 50.8 centimeters. But in most cases, you find that the male are taller than the females. Then we have the assessment of the head. We assess the head circumference. So the head circumference should be, the normal one is 33 to 37 centimeters. And then the chest circumference, the normal one is 30 to 33 centimeters at birth. So if you're not using centimeters, you can always use inches. Then you find out in inches. So you also go forward to assess the glucose and hematocrits for any kind of risk. Then we assess large and small for gestation age, which in most cases we focus on the weight at birth. Okay. Then we can look at other symptoms like if the baby is fidgeting, is having difficulties in just staying alone, then you look for those other symptoms which are abnormal in newborn. Then we have positioning and secretion management. So the normal position of a newborn at birth, when they're sleeping, is supposed to be supine position. Remember, they're still having the cord or the cord stem. So if there are secretions, we can make them to sleep on the side or on the lateral side. Then we use bulb syringe or the delay suction to delay suction 10 to 15 minutes post birth to avoid hypopnea. There should also be monitoring of vital signs and temperature following birth. So monitoring of vital signs every 30 minutes until 2 hours till the baby is stable. So from birth, every 30 minutes you monitor for 2 hours, then every 1 hour for 24 hours. Okay, so every 30 minutes you monitor vital signs. You know, when you talk about vital signs, the heartbeat, heart rate, the temperature, and all those other things, oxygen saturation. Okay, so after birth, check the temperature. Normal temperature at birth or normal temperature of a newborn is 36 to 37.5 degrees Celsius. When you get the baby is cold or less than 36 degrees Celsius, you can put the baby on skin to skin contact with the mother to radiate heat. Then when do we bathe the baby? All newborns are supposed to be bathed after 24 hours. Unless there's something very important you want to do or there are blood spillage all over the baby, then you can do it after 6 hours, 12 hours actually, half a day. So clean body fluids, massage the vernix into the skin. The vernix is that whitish thing you see on the skin, and mostly you get it on the head. Usually you call it, people say that is a sperm. It's not a sperm. It is not sperm. So the vernix is the one that helps to keep the baby warm and keep their skin actually moisturized. So a newborn is very sterile, very, 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 very sterile. You know where they are coming from. They're coming from the sterilest place, that is the uterus. So perform under warm by parent or by a nurse. So you can always bathe the baby in a place which is warm and not cold. Even if you're bathing them with hot water or warm water, you should make sure that the room is extremely warm. So for babies who are not stable, after 24 hours, you can still bathe them. You use just what we call tapid sponge, or you use a tapid bath. Make sure you get some sponge, or you get a soft cloth, you put in water, then you just wipe with the baby's body. So we have some preventive measures that we always give, like preventing vitamin K deficiency bleeding. So this is by administering vitamin K injection, which is done. If you have not given it immediately at birth, you can give within 6 hours. But after 6 hours, if there is no serious bleeding, you can always leave it. Then before circumcision, you make sure that you give vitamin K. Watch out for side effects like swelling, pain, allergic reactions, because some of them might be allergic to vitamin K even at birth. So you monitor signs of bleeding, especially from the cord stump, 2 to 3 days. We have also other preventive measures like the eye infection, for preventing eye infection. We have prophylactic treatment for Neisseria, gonorrhea, and chlamydia. So usually we give erythromycin or tetracycline eye ointment, which should also be given within 24 hours. So instilled in the lower conjunctiva of each eye. We like this thing of sharing this eye ointment. I don't know what is wrong with you people. So it is very important that when you apply this eye ointment, if it is only one and you cannot give to the mother, you clean it up before you put in another baby's eyes. You're carrying germs or infection from one baby to another one. So it may cause temporary conjunctivitis, and it clears out in 24 to 48 hours. So one of the things you should do in your assessment is to recognize any respiratory distress if it is there in a normal child. So there are some signs of respiratory distress. We have cyanosis, there will be pallor, grunting, nasal flaring, there is chest retraction. So you should know that the normal respiratory rate of a newborn is 60 breaths per minute. So you can also check for facial grimace. Then if you get any, you position, you sanction, and then you put the person in supine stroking. So some causes could be maybe the child is having a group B streptococcal infection. You can administer always antibiotics. Then parent-newborn attachment. It is very, very important that I say we put the baby on when you're delivering. The last step of second stage. Now it's that lateral flexion. Now when we are in the lateral flexion, people will put cloth on the mother's abdomen. Then they put the baby on it. The baby is supposed to be on direct skin to skin contact with the mother. As you clean and turn, then you change. So you deliver the baby direct on skin to skin contact to the mother. So that helps in attachment and bonding. So encourage eye contact in most cases. If the mother is breastfeeding, or even if they are not breastfeeding, let the mother be looking at the baby's eyes. Skin to skin, voice and touch. Bath times are bonding times and teaching opportunities. Educate on baby behavior, cues, and responsiveness. So those are the things you should encourage at birth to the mothers. Then we have post-transition cares. So post-transition cares are those cares that we are supposed to provide, especially during transition periods. Remember, when the child is born, they undergo some kind of adaptations. So we have cardiopulmonary functions. You need to monitor color changes. So when we are looking at cardiopulmonary, we focus basically on the paleness of the fetus and then the color all those other pinkish areas if it is cyanotic. So we shall check HCT or hematocrit, we shall check glucose and then bilirubin. Then we can also focus on thermoregulation. We need to prevent the baby from losing heat. So prevent chilling, which will increase risk of jaundice and hypoglycemia and eventually shock. So make sure that you also avoid overheating. I know you know how many number of pieces of clothes that the baby is supposed to be covered with. So the baby is supposed to be covered with, you put the outermost one to be a soft blanket, soft baby's blanket. Then you put a much heavier sheet, baby's sheet. Then the one which will be in contact with the baby should be soft and light. So that is how you lay it. So as you're about to deliver the mother, you make sure that this thing is laid already. But in most times, because we are not assessing the mother on a pathograph, we do not even know at what time she's most likely going to deliver. So the mother will deliver and you don't have where to put your baby afterwards, after cutting the cord. So also avoid overheating. Do not put very many pieces of clothes. 3 pieces of clothes. Baby's blanket, lighter bed sheet for the baby, and then the much lighter one. So we have hydration and nutrition. You should encourage to have neutral thermal environment that supports hydration in most cases to avoid losing water. Then we monitor. First void, the baby should urinate at least within 24 hours. Then the first stool should be within 48 hours. Some babies will even urinate immediately they come out, which is very, very healthy. So up to 10% weight loss within first week in most newborns. So the child will be born with about 2.5 kilograms, but within the first week of life, you find that the weight reduces. Then after, by the second week, because of adequate feeding, we expect that the newborn would have increased in weight or started to gain the weight that they lost. So we also look at skin integrity and cord care. We are supposed to teach those mothers on cleaning a perineal area with water and mild soap. Some people, they focus on cleaning the baby and they leave out the perineal part or the private part of the baby, especially those things of traditions that the mother at birth, they are not supposed to touch the baby's private part, especially the male child and all those things. So if you're not able to do that, make sure there's somebody who is bathing your baby because you're following tradition. So avoid alcohol, fragrance-based wipes. Sometimes people will start using those other wipes which are having alcohol in it. You are supposed to wash with water and mild soap. Make sure you wash. If you're using something, those wipes, you use the one which does not have alcohol and those fragrances. Then you teach the mother on umbilical cord, or even you yourself. You should check the cord at least within 24 hours to make sure it's not yet bleeding. By the time you're discharging, you check the cord also to make sure that it's not bleeding and it's clean. So it should be hair dry with no ointment. Diaper folds below the stump. People who are going to start putting the baby on diapers, make sure you inform the mothers that the diapers should not cover the cord stump. It should be below the cord. Then remove clamps within 24 to 48 hours. If you're still practicing those midwifery, old midwiferys that you leave the baby to go with clamps, then you make sure within 24 hours you remove those cord clamps. But it's important that we shorten and we leave the mother and the baby to with just a shortened cord stump to avoid even increasing infection. So we have safety measures. One of the safety measures is we need to prevent abduction at birth. So ID bands must match the mother's ID. Educate parents to report suspicious people, prevent falls, and with rail apps. So if the mother is sleeping, especially in the hospital beds, there should be those beds with rails. Remember, this mother who is coming out of the labor suit or out of operation room, they might be tired and they fall asleep, and before we know it, the baby has fallen off the bed, or even the mother has fallen off the bed, and it will give us more problems. We should also practice hand hygiene. Scrub hands at shift start. Make sure you scrub your hand, not only at shift start. Every time you're going to where the baby and the mother is, you wash your hands. And after you're finished with them, you wash your hands. After you have given them whatever, so long as you have touched the patient or gone around the patient's bed, you must wash your hands, even before you go to another patient. So washed hands after each newborn contact. Because I said they're sterile at birth does not mean you're not supposed to wash your hands. Make sure you wash your hands each and every time, and for each and every newborn, including the mothers. They're supposed to wash their hands before breastfeeding. They should wash their hands, wash the breast even before breastfeeding. Then monitoring for complications. Monitor risk of infections, hemorrhage, cardiopulmonary issues, and relieve cyanosis like emergency. Check for heart defects. Other things like jaundice, bilirubin checked within 24 hours. So recheck before discharge. Just make sure you generally assess this newborn. Assess for any complication. Then we have circumcision care. Some mothers prefer for their newborn to be circumcised at birth. So if there is any that was done, you make sure that the baby is stable and parental consent was required. Don't just go and cut somebody's baby without asking them. So you do postoperative care, reassess the site 30 minutes to every 2 hours. Every 30 minutes for 2 hours. Then monitor voiding, monitor how the baby is urinating within that specific time. No ointment should be put on with plastic balls. So it falls off by day 8. Then yellow granulation tissues is a normal healing. Most times when you see those yellowish things forming around the part which was circumcised, it's normal. Then look out for signs of infection and bleeding still on the circumcised foreskin. Then we have care of uncircumcised newborn. Most times we are supposed to retract the foreskin and then we wash. But if it is not retractable, do not force it. Natural separation occurs by 3 to 5 years. Build-up of white cells is harmless. So we look at enhancing of attachments. They're supposed to teach the parents on how to make sure they attach themselves with the newborn. So we already looked at some of them. Educate on babies' reactivity cycles. Communicate via gestures, gaze, and cry. Then we have newborn feeding. When you look at newborn feeding, the child is supposed to feed at least 12 times. At least 12 times in a day. So critical periods for growth, this is a critical period for growth and brain development. So exclusive breastfeeding or iron fortified formulas should be given for the first 6 months. So the iron fortified formulas are given for those other newborns whose parents maybe died or whose mother died at birth. Then the ones who is having the mother, they should exclusively breastfeed. That means the baby should feed and feed only on breast milk. Introduce complementary feeds after 6 months. Those are the other feeds like porridge and what should come after 6 months. Continue feeding until 12 months. So when we are introducing complementary feeds, it does not mean we are stopping to breastfeed. It means we are reducing the number of times we are breastfeeding this baby, but we are adding other feeds on top of the breast milk. Then we have normal and abnormal temperatures. I believe you already know. You can see from the slide there. So lastly, we have a brief, something brief, especially for babies at term. Dry immediately, skin to skin care. This is like immediate care that you're supposed to give at birth. So the immediate care you're supposed to give at birth, and you follow it in this very order that you're seeing. Okay, so we have dry immediately. Sometimes we really rush to, before even you dry the baby, you want to start sucking out the mucus from the baby's. So you dry the baby immediately. Put on skin to skin contact with the mother. Put a warm linen and cup. You initiate breastfeeding. Early breastfeeding, delay bathing. I told you are supposed to bathe this baby after 24 hours. Some of you, because you're seeing the vernix on the baby's skin, you start accusing the mother it is a sperm which is visible on the baby's skin. You start telling the mother how unclean she was. That baby is very clean. So do not bathe the baby immediately. Then monitor temperature, not only temperature, vital signs regularly. So all in all, when we are looking at the normal newborn, there are a lot of things we look at. We look at those other preventive measures first. We make sure that the child is safe from any kind of infection, whether it's being the one that is supposed to be passed from mother to child and all those things. Then we look at those cares that we are supposed to give to the child to prevent them from, as they are undergoing transitional phase or adaptation to extrauterine life, they are not really getting difficulties. Then we are also looking at care which should be given within 2 hours. So within 2 hours, you should examine the baby every 30 minutes. Every 30 minutes, you go and assess. That means the baby should stay in the labor suit. If the labor suit is not crowded, or the baby should stay in the labor suit actually for at least 2 hours, plus the mother. For the mother, you're monitoring if there is maybe PPH and all those things. Then for the baby, you're monitoring if there is any changes which might become abnormal before you finally take them to postnatal. So thank you so much. That is all you need to know about a normal newborn. The first 24 hours of a newborn is very critical, and the first 1 hour is the golden hour. So even if you were very, very careless, at least make sure the first 1 hour you monitored the baby closely. Everything you do on them, you record. Thank you so much for listening. We shall start from there. Now that we already understood we already know about how the newborn came about, and now that it is born, we shall be looking at other things concerning the neonate. Thank you for paying attention. I still remain the same presenter. Shall meet in the next session.